Thank you very much. So Africa, just like any other continent, is preparing for the COVID-19 vaccine introduction. And so far, we are at an overall weighted readiness of 37%. Yes, that is quite way below what we expect for the vaccine rollout. But I must say that we are working very hard to get countries to the level. Countries at different levels in different aspects. We are assessing 10 different pillars of vaccine introduction. Vaccine introduction is such a very intricate issue, and it's for, especially for the COVID-19 vaccine, where the world is introducing the vaccine at the same time. This is unprecedented. It has never happened. But our countries are not new to new vaccine introductions. The only difference is that we are discussing a vaccine we do not yet have in hand. So that makes it a bit difficult. But for now, countries are working really hard, and we are supporting the countries to ensure that they're prepared. We are at 37%. But we believe that by mid-January, we should be able to be at the 70s, like most other countries.
Oh, okay, yeah, and that's what I was about to ask. I mean, help us better contextualize this 37%. What does it mean insofar as the material tools we have in rolling out a vaccine, and what is the ideal position to be in?
All right, so this 37% is taken from planning and coordination. For example, each country has been told, we have advised them they need a national task force. Has the country put in place a national immunization technical advisory group that will make recommendations for this introduction? Do they have enough resources and funding to introduce the vaccine? Have they put in place expedited regulatory measures so that when the vaccine is about to be imported into the country, do they have all those measures to ensure that within the next 10 days the vaccine has already been registered? Prioritization of target groups. Who is going to be vaccinated? Where are they? How are we going to get to them? Countries need to have made that decision. And a number of countries have not even decided who is going to be vaccinated. We have things like training and supervision of health workers. This is a new vaccine, a vaccine we've never seen, a vaccine we've never handled. So health workers need to be trained. We are finalizing at the World Health Organization level, we are finalizing the guidance document on training tools. So countries have not trained anybody because we still do not know what vaccine we are going to get. And that pulls us down. So it puts, for example, training at 0%. So it pulls everything down. But for things like planning and coordination, countries will tell you that they're at 50% because they have task forces in place. They know what to do when a new vaccine comes, but they just do not know what the vaccine is. We have things like demand generation and community engagement, but we can't start engaging communities when we do not know, when the countries have not decided who's going to get vaccinated. So something like that also takes us back to 0%. Even when other parameters will be at 60%, if you have two zeros, they will definitely bring you down. And then the 37% is for the whole continent. So we have some countries at 60%, others at 5%. So the average gets us 37. But the ideal, 80% would be ideal.
Right. And where does South Africa fare on that spectrum? I mean, do you have that figure available to you of this country's state of readiness to roll out a vaccine?
I would not have that offhand,
Okay.
but what I'm aware of is that South Africa has a number of activities they've completed and a number of activities that are in progress. For example, your cold chain needs, and what abilities you have in terms of cold chain and what your needs are. You have decided who is going to be vaccinated and where to get resources from the government and things like that.
Right. Amongst the many concerns that have also been raised is to do with the volume of the vaccine that's likely to be given to countries in Africa. Some experts disagree, but we've heard that, you need about a sizable amount of the population vaccinated for there to be a effective, call it chain reaction that protects the rest of the population. The reports we've seen is that South Africa is only going to receive enough vaccines to only inoculate about 3% of the population, which is a far cry from about the 60% apparently that's needed, according to some experts. How concerned are you about the units of vaccines that are going to be available for countries in Africa?
So actually, South Africa, just like any other African country, is expected to receive vaccine for 20% through the COVAX facility, the facility that is collated by WHO, Gavi, and CEPI. So each country in Africa is expected, we are working very hard to ensure that we get vaccine for 20%. I believe that 3% is the percentage of health workers in the country, is the percent that the health workers and social workers take care of, because that's one of the top priority target populations. But we'll get vaccine for 20%. But if South Africa as a country wants vaccine for more than 20%, that 20% will come fully subsidized by the COVAX facility. But if the country needs vaccine for more than 20% of the population, they will copay, and on top of that, after a certain percentage, pay fully for this vaccine. So you should be able to get the vaccines that you need, especially if a country makes bilateral agreements with COVAX to be able to get more vaccine from the manufacturers.
Are you able to give us a bit more insight?
That the country should be ready to pay.
Right, of course.
I beg your pardon?
Yes. Are you able to give us more insight into how official scientists came up with that 20% figure? I imagine, of course, not just a thumbsuck figure. Is it more linked to capacity, perhaps, or scientifically speaking, would South Africans be safe just with inoculating 20% of their population?
So this figure came from modeling data of the vaccine that we shall have, the number of doses of vaccines that will be available. This is the first time we are telling manufacturers to ramp up and manufacture lots of vaccines because it takes about 1.5 years, usually lead time, that we give a manufacturer, we need 2 billion doses. Please make us 2 billion doses. It will take them about 1.5 years. But right now, we are telling multiple manufacturers to give us huge doses of vaccines to cover the whole globe. So one of the issues that was considered was the supply. We shall not have enough supply for everybody, for the 60% ideal that would have to be inoculated. Then the resources available at hand, financially, what we have now will be able to cover at least 20%. And this is because we needed an equitable supply. We know that you mentioned at the beginning, the higher income countries have made bilateral deals with the manufacturers. So what we shall get as COVAX facilities, 2 billion doses by the end of 2021 to cover our COVAX facility countries. And when we equitably distribute this, we get to 20%. So there was no scientific basis behind it. That is why we are going for the most vulnerable and most at-risk populations. If we reduce the transmission among those, we reduce the economic impact. And then with time, by the mid-2022, we hope to have reached the 60% coverage for most countries.
Wow, that's quite a startling admission. It certainly does drive home the idea that even once we do get the vaccine, actually our fight against COVID-19 is far from over. But, what we've also seen in the past few, call it weeks, months, are, concerning sentiments around vaccination to begin with. And this is not restricted to Africa. It's the world over. How worried about you about these perceptions in a continent like Africa, where things like religious and cultural principles are still foremost to how people lead their lives and respond to various illnesses?
Thanks again. That's pertinent because we have also never had as much infodemic as we've had when it comes to any disease, let alone a vaccine as we've had with COVID-19. So we've put in place also mechanisms to support countries on communication and demand generation and risk communication and community engagement, just like we've had to continue communicating about mask up, do the physical distancing, sanitize. We have to communicate and engage communities about the vaccine itself. We need to get communities to understand that this is a vaccine that is there to save their lives, just like any other vaccines. I don't know if you know that in 2019, the World Health Organization listed vaccine hesitancy as one of the top 10 threats to global health. And this has not changed much. So communities just need to know. The good thing is that we've all seen what COVID-19 has done to us. So I want to believe that with the coming of the vaccine, we shall have less hesitancy than we've had for a number of past vaccines. It is just optimism, but we are training countries, we are training communicators, the media. That's why you're there. We hope you'll make us and help us to communicate better with masses because they believe in you and what you tell them. But social media, putting up all ways and channels to ensure that people understand that this vaccine is here to help us end this pandemic.
Absolutely. Still so many important, crucial considerations to be making at this time against our fight against the virus. Thank you so much for your insights. Certainly appreciate your coming through onto the AM report in South Africa. Dr. Phionah Atuhebwe is with the World Health Organization in Africa. In fact, she's the Regional New Vaccine Introduction Officer.